Welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us. We're going to be speaking with Ashleigh Burdette this morning, Director of Clinical Innovation at Biologics By McKesson. She's joining us here on the program to explain that though personalized care is essential for cancer patients, it's even more so during COVID-19 and post-COVID. Welcome to Health Professional Radio, Ashleigh Burdette. Thank you.
Thank you for having me. I'm happy to be here.
Give us a brief look into your area of expertise and talk about your role there as Director of Clinical Innovation at Biologics By McKesson.
Sure. Well, my name is Ashleigh Burdette. I am the Senior Director of Clinical Innovation at Biologics By McKesson. I am a registered nurse by training. I hold a Master of Science in Nursing with a focus in nursing leadership and administration. And I'm also an oncology certified nurse. We at Biologics are an independent specialty pharmacy that specializes in caring for patients with cancer and rare diseases. So we have more than 27 years of experience in oncology. We dispense more than 150 different therapies. About 100 of those are oral therapies. And about 12 of those therapies are exclusive to Biologics By McKesson, which basically means that we are the only specialty pharmacy that dispenses them. Our physical pharmacy is located in Cary, North Carolina, with a second site opening later this year in Fort Worth, Texas. Okay. So that's a little about what we do.
Now, as I said, personalized care when it comes to cancer patients, that goes without saying. But how is it even more crucial in the age of COVID?
Yeah, that's a great question. So our focus at Biologics is really on patients and caregivers. We know that when you are faced with a life-threatening disease, that impacts every single aspect of your life. And so we strive to do everything we can as clinicians to holistically support families throughout their treatment journey. So our primary goals are to simplify the access to therapy and provide that personalized clinical support that helps patients understand things like how to take their medication, how to manage side effects, and ultimately how to achieve the best possible outcomes. So we also work with patients to help get the most benefits from their insurance coverage, including assisting with benefit investigations, assisting patients with navigating the prior authorization process, as well as helping patients find financial assistance if and when they need it so that they can afford the treatment that's been prescribed to them. I think one of the biggest reasons that personalized care is so valuable is simply due to the fact that patients are people and people are different. If you think about it, just because, a group of patients may share the same cancer diagnosis and are on the same therapy or maybe are getting ready to start the same therapy doesn't necessarily mean that they'll need the exact same type of support or the same frequency of engagement by their healthcare provider. And what I mean by that is some patients may need to connect with a clinician on a monthly basis. Others may need daily support for a period of time. We have some patients that have a lot of questions around how to remember to set up a way to remember to take their medication as prescribed. And then we have other patients that feel like they have a good understanding of how to set up a way to remember to take it, but they have a lot of questions about how to manage some of the side effects. So it's really about understanding each patient's needs and being willing to meet those patients and their caregivers wherever they are so that they're getting the right support at the right time. As an example, I think we could probably all think of two people in our daily lives who are complete and total opposites. I know for myself, I'll share an example. My mother and my mother-in-law would be a wonderful example of this because it doesn't matter whether I'm talking to them about their health or their disease management, or whether I'm talking to them about what we're going to purchase when we get to the grocery store. I have to communicate with them in very different ways to get positive responses and outcomes. So when we talk about personalized care, I really think it's simply due to the fact that patients are people and people are just different.
You know, these personalized care plans, it would be par for the course with someone so at risk for COVID-19. But once the patient is out of the COVID-19 woods, as it were, does the plan go back to what it was prior to COVID? Or is it something that, you know, you're going to keep at that level throughout the patient's journey?
Yeah. Well, two thoughts on that. I think, first of all, one of the things that happened as a result of COVID-19 is that there were delays in identifying new cancers. One study that was published recently showed a decrease in cancer screenings as compared to baseline of 85% at the peak of the pandemic. And I think the reason this is so important is because delays in diagnosis can often lead to a cancer growing or progressing to a more advanced stage, resulting in a higher mortality rate. So I think taking this into consideration, you can see why personalized care is really going to be so important, not just now, but moving forward, because everyone will have a different experience. Everyone will have different circumstances from both a disease management perspective as well as a quality of life and an emotional perspective. Secondly, I think the COVID-19 experience has forced a rapid adoption of telehealth services across the healthcare industry and has demonstrated that not all visits need to be in person necessarily. When I think about patients that, for example, are driving long distances to reach their cancer center and to meet with their provider and incurring the cost of travel and lodging, having the options for not all, but some of those follow-ups to occur from the comfort of their own home is incredibly valuable. I think this adoption and integration of telehealth has been needed for quite some time. And I anticipate that this will largely stay even beyond COVID-19 as a means of reducing the patient's stress, reducing exposure or the risk of exposure to patients who may be immunocompromised. And then going back to what I mentioned earlier, I think it's critical that we continue to focus on meeting patients wherever they are in their journey and provide the personalized care that these patients and families need and deserve so that they in turn can focus on the moments that matter the most to them.
Where can our listeners go and get some more information about Biologics by McKesson and more about some of the treatment options that we've been talking about this morning, as well as how you're networking with payers, providers, and pharmacies? Yeah.
I would say the best place to go would be our website, biologics.mckesson.com.
Great. Well, I appreciate you joining us here on Health Professional Radio this morning. Thank you so much.
Yes, well, thank you so much for having me. This has been fun, and I'm thankful for the opportunity to serve in this space.
Well, you've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Ashleigh Burdette, Senior Director of Clinical Innovation at Biologics by McKesson. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download it at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.